So we'll start, just going to sort of group them together in threes. So we're going to start with anxiety disorders, obsessive-compulsive disorders, and trauma and stress-related disorders. So anxiety disorders, these are the disorders that most people are familiar with at this point. These are those in which the patient experiences intense, frequent, and uncontrollable anxiety. So anxiety is a state of unpleasant mental and physical arousal, as I'm sure every single person who is watching this video has experienced at one point or another. It's not comfortable, it's not a fun experience, but it is normal and it's necessary for humans. It becomes pathological when it causes significant distress and it impairs normal functioning. So we need anxiety to survive. It helps us avoid bad situations. But when there's no root of the anxiety, or when it becomes pathological and it affects our daily lives, that's when it becomes a disorder. So it's the same thing with panic disorders. A person with panic disorder has experienced at least one panic attack and worries about having more. So panic attacks are acute experiences. They come and go. They usually last about 30 minutes, but they are, again, extremely uncomfortable. They can be very terrifying for the person experiencing them. And during that, the person may experience a variety of psychological and physical symptoms, and it's usually the physical symptoms that are the scariest. And these can include, but are not limited to, heart palpitations, shortness of breath, chest pain, a feeling of intense dread, sweating, chills. So a lot of time panic attacks get confused as heart attacks, and they send people to the emergency room. So if there's no like physiological basis for the chest pain or for the shortness of breath that the person was experiencing, it's a pretty safe bet to say that it was just a panic attack. So if this person has a panic attack and then is completely preoccupied with this and just feeling terrified that they're going to have another panic attack, they'll most likely be diagnosed with a panic disorder. So it's not good. But the good thing is that panic disorders are usually very responsive to treatment, which is a good thing. So we have generalized anxiety disorder as well. We spoke a little bit about anxiety just now, but GAD is a disorder that causes one to feel tense or anxious about most things, but it doesn't cause panic attacks. So the source in generalized anxiety disorder, the source of one's anxiety may seem like it is constantly shifting or even unidentifiable. So you could just have this sort of generalized anxiety for which you have no idea where it came. You can have anxiety for one specific thing that you think is the root cause of all of your anxiety. And then once you solve it, you just realize that, nope, now I'm anxious about something else. So that is also a pretty common thought process for generalized anxiety disorder. And there are a wide range of symptoms for anxiety. A person may experience restlessness, poor concentration, irritability, insomnia. They could have a loss of appetite. Phobias as well are considered anxiety disorders, and a phobia is an irrational fear or an aversion to something that the patient fully understands is irrational. So that understanding that the fear is irrational does absolutely nothing to help the phobia. So they can often have evolutionary roots. A lot of really popular phobias, for example, are spiders. People are afraid of heights, maybe needles are another big one. And they're further divided into 4 categories based on their triggers. So situational, for example, some people may be afraid of bridges, or they may be afraid of very open spaces. Natural environment, maybe people are afraid of thunder or certain weather conditions. People can have a phobia of tornadoes, for example. Maybe they had a bad experience once. Blood injection injury. People, like I just said, will have like an irrational fear of needles, maybe, or just an irrational fear of seeing blood. Thinking about blood sometimes can even do it to people, and animal fears as well. So people can be afraid of dogs, spiders, lions, anything, any sort of animal. Social anxiety disorder is sometimes still referred to as social phobia. I believe in the past DSMs it was considered a phobia, but it's called social anxiety disorder now, and it's an unreasonable or paralyzing fear of socialization due to the possibility of humiliation or embarrassment. Social anxiety disorder can be really disruptive for people that have it, because it leads to this behavior known as avoidance. And that just reinforces social isolation. So if you look at the graphic that I have to the right, we basically start with anxiety. And if you don't actively work to get rid of your anxiety, it leads to this behavior called avoidance, which means whatever you pinpoint where your acute anxiety is coming from, and whatever that is, you avoid it. So for social anxiety, for example, if you are invited to a party, and you start to get really anxious the night of the party, and you start to think about all these interactions that you're about to have and the possibility that something's going to go wrong and that you're going to make a fool out of yourself. What might you do? You might call your friend and tell her that you're not feeling good and that you're not going to come to the party tonight. You'll immediately feel better, but that's avoidance. So you see right over here, we have the short-term relief. You're immediately going to feel better, but long-term anxiety growth. Your anxiety is going to get worse because it's just operant conditioning. So you're going to be more likely to avoid situations that give you anxiety in the future. So it's a very bad, it's just a very bad cycle. So a lot of times the way that psychologists treat anxiety is just by treating it head on. So the next type of disorders are obsessive compulsive and related disorders. So obsessive compulsive disorder is a condition that causes the individual to have obsessions, compulsions, or both, which is an important part of OCD. You don't have to have both obsessions and compulsions. Sometimes the compulsions are not present, but obsessions usually are, just be based on the definition of what a compulsion is. So an obsession is a repeated and intrusive thought that causes distress and anxiety. So any sort of thought that is repeated and intrusive, it could be anything. So for example, one of the most popular ones, or one of the easiest to understand, you can have an obsession, this intrusive thought that your hands are constantly dirty. You might feel something on your hands. You might think about how dirty they are. You might think you smell something on your hands. And there's just this thought in your head all day running through your mind about how dirty your hands are and how you're touching everything and how it's getting dirtier and dirtier. So the compulsion is a repeated behavior to try to reduce distress or prevent a dreaded event from occurring. So the compulsion is being performed in response to the obsession. So if your obsession is that your hands are awfully dirty, you're going to be washing your hands, say. Maybe you go to the bathroom every 5 minutes all day long just to wash your hands, and you wash them for 45 seconds at a time, and you're rubbing your hands, scrubbing them down, and you're starting to blister your hands. That would be a compulsion. So that is what obsessive compulsive disorder is. The compulsion, that behavior, is you're trying to reduce the distress that is caused by those thoughts. And people with OCD, again, they understand that their obsessions or their compulsions are not reasonable, and they can't help it. That compulsion is really there to just try to get rid of that obsession. So again, it can be very destructive. And the third type of disorders in this group, trauma and stressor-related disorders. So similar to anxiety disorders, and they were actually once categorized as anxiety disorders, but they've since been separated in DSM-5. These disorders are usually a response to a traumatic event, and can have other symptoms not usually present in anxiety disorders. So all those symptoms that we spoke about before are present in trauma and stressor-related disorders, but they will also experience dysphoria, aggression, dissociation. Those are just a couple of them. So the most popular or the most well-known disorder is probably post-traumatic stress disorder, and that often results in intense feelings of horror, fear, or helplessness after a traumatic event. So it's estimated that over 50% of people will experience a traumatic event in their lifetime, but only a small portion of the people that experience that event will develop this PTSD from that event. So those with PTSD are going to they may relive their trauma, usually through dreams, flashbacks. They'll sometimes have dissociative episodes where they are just completely cut off from reality for a little bit, and they are just stuck in a flashback, thinking about that traumatic event. So for a PTSD diagnosis, symptoms must be present for at least a month. So if they have these symptoms and it hasn't been a month yet, they cannot be diagnosed with PTSD. However, if they do have these symptoms, and it's longer than 3 days, and it's from 3 days to 1 month, they will probably be diagnosed with acute stress disorder, which is basically the same thing as PTSD. It just has not had a long enough time frame to actually become PTSD. So it's the same symptoms. The only thing that really differs is the time frame. So if these symptoms persist past 1 month, then that individual is most likely going to be diagnosed with PTSD. Then we have adjustment disorders, and those are the ones in which the individual experiences a maladaptive response to a stressor rather than a trauma. So it's basically PTSD, but we're not talking about a traumatic event. So a traumatic event would be something like, we talk about veterans all the time with PTSD. Traumatic event would be, watching one of your friends get killed to the right of you. When we say stressor, we're really talking about daily stressors. So a romantic breakup, say, maybe issues in the workplace, anything like that would be considered stressors, but we still do have pathological responses to them. So these adjustment disorders usually don't last as long as PTSD as well, just because the trauma obviously is it's a lot more powerful than just daily stressors, but adjustment disorders usually last about 3 to 6 months. And it's important to note that individuals with lower socioeconomic status are much more likely to be diagnosed with these kind of disorders, with trauma and stressor-related disorders, because they encounter more stressors daily.